All right.
I know Brandy's here somewhere.
Yeah, he's meeting with Mary, so we'll just go ahead and get started.
Is there
Okay.
an agenda?
Oh,
I'm sorry, I didn't mean
An agenda.
to, that one there. I didn't mean to interrupt you. Thank you.
Ian, you're both here and on
She
this?
is in the
Yeah,
AR.
if I can display.
Yeah, gotcha. Two Ians, all right.
Wow.
All right,
Sweet.
we'll go ahead and call to order our Mason County Board of Health meeting for May 23rd, 2023. We'll begin with introductions. I'll start Kevin Schutte, Board Chair and County Commissioner.
Sharon Trask, County Commissioner.
Carrie Davidson, Shelton School Board.
Peggy Van Besker, Costville District 2.
Kathy McDowell, City Council, seat 2.
Should we not, Blue Zones? Melissa Casey, Public Health and Human Services, Community Health.
Ian Tracy, Mason County Public Health and Human Services, Environmental Health Manager.
Dave Linden, Mason County Public Health and Human Services Director.
Randy Nevlin, Mason County Commission. Nobody.
Very good. And then online we have both, Rebecca Shipman. Excellent. Okay, with that, we'll move on to approval of our agenda today.
I'd like to make a motion to approve the agenda as presented.
I'll second.
Kathy, second.
Everyone in? I'll
It's been
second
moved-
it.
It's been moved and seconded to approve the agenda. All those in favor say aye.
Aye.
All those opposed, and the motion carries. Moving on to item number 3, approval of minutes from our March 28th meeting.
I'll make a motion to approve the March 28th, 2023 minutes as presented. I'll second.
It's been moved and seconded to approve the March 28th minutes as presented. All those in favor say aye.
Aye.
All opposed, motion carries. And then with that, we'll move on to our health officer report.
And she is in the ER today, so.
Working, not,
Working.
Not
Not as a client thereof,
yeah,
yeah.
yeah.
That's
Yeah.
good.
So I'll pinch hit a little bit. So we've been working with Dr. Gardner on a number of things, especially on some grant applications we're working on. And what is that word? I cannot remember.
Syndemic.
Syndemic, yeah. So it's around.
That's a $5 word.
It is, and we can't even look it up. We don't know what it means. But around substance abuse, so we've had for the past several years the syringe exchange, but this would take the syringe exchange to the next level. So instead of just the exchange, be able to do Hep C testing, HIV testing, Hep C treatment, wound care. Basically elevating everything up for what we could do. And then if this does go through, we were looking at replacing our motorhome with another vehicle, a van, to do the outreach from a better facility. And then expanding that into A1C checks and blood pressure checks and going to events around the county and really expanding public health out into the community instead of just being in our own little building. So been doing a lot of work, talking with a lot of folks around that, looking at business models, and Dr. Gardner's been leading that effort on the programming piece, then I work on the logistics piece for her. So we've been very busy with that. Tuberculosis has calmed down. We haven't heard much out of that in a while.
Don't say it out loud.
Right. COVID, with the governor's proclamations ending, they're working on what does that mean for the healthcare industry, and hospitals are free to do what they choose to do now. And we're kind of cleaning up some of the contractual things that have been having COVID inclusions and taking some of those back out. So that has kept things rolling, because we're in that process right now of doing contracts for the June 30 shut off, July 1st kickoff for the next biennium time period. So a lot of that stuff is rolling through the office, and Dr. Gardner looks at that stuff too. What else has she been working on? There's just been a lot of things. She was here for a week, a little over a week, and was in the office all the time working with staff. So
That's cool.
yeah.
I have a question.
Mhm.
Is that van that you're talking about, is that a needle exchange also?
Yes.
Okay.
Syringe exchange also, yeah. So this thing is, it kind of takes syringe exchange, and really right now the user population is switching away from syringes to smoking. So they're not using syringes nearly like they were. So this also gets us a chance to do the HIV and the Hep C testing and treatment, which is we've been having difficulty getting Hep C treatment going, but this gives us the ability to do that through standing orders from Dr. Gardner. So we'll have to hire staff and.
So have you talked to Bo at all about, because they have the physician that goes out that can do, okay.
It's similar to that, but we're staying out of the primary care.
Okay,
So the idea is to do.
but I just thought he might have some ideas about the.
Right, and actually I spent the day with the crew from Peninsula Community Health and looked at all of their vans and
What they
spent the
do.
afternoon with their team that goes out and does the outreach. So they have behavioral health outreach, they have a dental outreach truck, and then primary care with behavioral health that goes out. And in talking to them, they thought that they would have about a year, maybe a little more, with the vans going out and getting people connected to the services through their brick and mortar facilities. And that is not the case. That particular population does not want to go into a brick and mortar.
No. That's
So
why they're out there.
That's why they're out there. So we're saying, okay, well, we've got this need through the homeless population and other shut-in populations. How can we do a public health outreach and then connect them to other services? And we'll probably be doing referrals to Peninsula Community Health and referrals to Mason Health.
So you would put this van in different spots in the county for, what, a week at a time in one spot? And
No, it would be changing on a daily basis.
okay,
Yeah. So, and have regular routes.
right.
So, it gives us the ability to take it to Oyster Fest and Forest Festival and, to have that public health outreach. So we were thinking wellness on wheels, the WOW truck, but Peninsula already has that, so I'm like, oh, man.
Copyright.
Yeah, so wellness outreach wagon.
The wellness wagon,
The
yeah.
wellness wagon, WW.
Yeah,
So we're exploring that. We're just finishing up the grant. So Dr. Gardner was doing her piece last night on the grant. We turn that in next Monday, I think. No,
Next 2 weeks.
2 weeks, okay. And working through all the pieces on that grant. It's going to be a pretty big one. I think we're well positioned for that grant. We talked to other health jurisdictions. They're not applying. Okay, works for us. And it really does fit in with what the legislature and the governor's office was working on during this legislative session. So getting some outreach into the community. And public health just has not done that in the past. And I think that's, as we sat and we talked and thought this through, where are we going to go? Because people don't beat our doors down, and there's just a lot of need out there, a lot of gaps. So this is a way for us to get out and connect the dots in the community.
And they get frustrated and don't know where to get help. So if you're doing the outreach, then you can point them the right direction.
Right. And we have Evergreen Treatments coming over to talk to us about how they're doing outreach for mental health. So they're coming over on Friday to meet with us. So we'll be looking at how we can coordinate public health with Evergreen, with Peninsula Community Health, and really cover the community. So the other piece of that is how do we cover the Hispanic population and make sure that that community gets connected as well.
Yeah.
So part of the grant would allow us to do STD, STI work as well, so substance abuse, sexually transmitted disease, infections, and do treatment as well through this fund. So we're looking at a van that would have the capability to do, they have an exam room, small bathroom, a phlebotomy chair, and then a place where people could sit and talk. So kind of like a little counseling place.
That's a big bus.
Actually, not that big. I went over and explored, and they have some pretty cool setups. So, but they had one that was really big that had all kinds of cool stuff in it. But that's
Housing
not us.
room, mental health room.
Yeah. So, well,
Dave.
yeah. So it's
I have one more, I'm sorry, I have
Yeah.
one more question.
sure.
So how to reach the Hispanic community? Would you take that van into their neighborhoods? Because we know that they live in neighborhoods.
Right.
You know, they're together.
That's the thought. Yeah.
You're better off, I went through that with the vaccines and stuff, you're better off going through the churches.
I was
And
gonna say they
remembering that you
have it.
could be in a room talking to somebody, you have an interpreter for them, and they literally can't talk to the next one in line.
Yeah.
It's a different dialect, and it's, you would think they'd be so similar, and it sounds like they're not.
There's five
Yeah.
dialects.
But yet the churches, because they interpret for each other, their services, it worked well for me. I was able to have the ones that could bridge the gaps between the different dialects.
It was interesting, one of the providers over there said that the thing that people were interested in seeing was the same person on the van each time. Now, typically, it's not the provider that it was the support person that goes out.
Yeah.
Right.
As long as they have that familiar face,
Nope,
then
that
the
makes sense.
provider, the providers can kind of change out, but they want to see that same support person each time.
That's why I had to ride on some of those buses and stuff like that and be there, they wouldn't get off the bus. They literally were terrified, they don't know. And I couldn't speak their language, it was just me, that big ugly guy that's waiting for them at the end, they know we'll protect them, that's all it was. I just done a good job and stuff like that's the best I could do.
So we're exploring, getting the grants out there, and we'll see where we go from here.
Yeah.
Great. So you're collecting letters of support? I heard.
Right.
So if your organization, whoever you're representing, would like to also probably provide a letter of support,
Mhm.
Dave and Melissa would be happy to take it. But maybe even consider asking the managed care organizations
Yeah,
to provide letters of support.
And the
And-
fire department
Yeah.
stuff.
we did go.
And the hospital districts.
Yeah, yeah.
Maybe you could shoot us
I
get a
can
hold
do
of
that.
Sandy, and, because I'm sure we would do that.
Yep. So, in a way, they kind of have, because
Oh, okay.
through Peninsula and through Choice,
Right.
some of the board members kind of cross over and added their. So, and then the hospital up here was another support. So, but yeah, I will reach out.
Yeah.
Yeah,
Great.
if you would like school district support,
Mhm.
I mean, whether it's this or outreach to some of the communities, I mean, we have different people that help out with those services as well within the school.
If we've learned
So-
anything about the legislature and any of those groups that get money from the legislature, it's sphere of influence that's important. And I could believe when we went out for money for the bypass, you wanted to have transit there because there are legislators that are just nothing but transit. You bring a transit body, they're like in, doesn't matter what it is. And same thing with others, economic development. Well, schools, I can assure you, there's legislators and the like that all they gotta do is walk in and be a school and they're like, you got us.
Great. Well, looking forward to hearing more about that. It's exciting. Anything else from Dr. Gardner?
She'll be sending in written stuff, I'm sure. So,
Okay, great. So back to Dave for administrator report.
part 2. So, okay, we have unspent Foundation of Public Health Services funds, and those Casey and I are doing the estimation on what won't be spent, and we'll get that sent back to Department of Health by the end of June, and that money will come back to us again in July. So. The legislative update on that is we were continued for our standard FPHS, and they added another $100 million. Now, we have not asked for any of the $100 million specifically for Mason County because we didn't spend what we had this year. But we're going to be getting some pieces for environmental health policy work. We haven't decided exactly how that's going to look for us. What some of the districts are doing is hiring a deputy environmental health manager to allow the environmental health manager to do more policy work. So we'll see how it pans out. It may not. We don't know how much the money's going to be either. We just know that there's a slice coming. So we'll see that probably in a July consolidated contract, CONCON update. I just did the CONCON update for June. There's no surprises in there, not much money in there of new money, just kind of some continuing things. And a couple of statements of work changed, but really nothing very big. We have COVID dollars that are going to be going back that are unspent. So at the end of this, at the end of June, all of those funds will go back. So at this point, there's
Do you know
no
about how much?
several $100,000.
Is there anything else you can see that we can spend on?
It's for COVID vaccine,
Yeah.
and we're just not getting demands for COVID vaccine work. So, and I talked to the hospital, and they aren't getting a big demand either. So,
We're all used to it now.
yeah. So that'll be going back, and then, like I said, our July allocations should arrive. They redid. We spent the last 6 months working with DOH to help them with their system of getting the contracts out and ready, because last year, as you recall, the July contract didn't get to us until, I think, late October, November. And we weren't allowed to, DOH says, well, just go ahead and back bill, but legally, you cannot back bill. If there's not a contract in place, you can't. So that's part of the money that was left unspent, is because we weren't allowed to spend it. So,
Dave, if you can test people, you're poking them some way, is there any way you can also give them a vaccine? Just stretching it a little bit, you use that money to buy the vehicle that you were talking about in order to go out there and have vaccine opportunities wherever you go at the same time.
Right.
Maybe that money could be spent on that vehicle. Just trying to put little pieces together.
yeah, so we kind of explored that. The answer on that was no. But we're working on something similar to that. We've got kind of a savings account through the treatment sales tax that can go towards the vehicle, because that would certainly fit inside those brackets.
Yeah, I'm not sure I see that to go back. If we can capture it
Yeah.
anyway, we should.
And then we will be able to do vaccines with the van. That's maybe do back to school vaccines clinics. So exploring that as well. Because what we're seeing in the tracking right now is that the back to school vaccines are way behind. So
Due to the COVID.
due to COVID, right? So we fully expect to see that first couple weeks getting to be pretty busy as the school nurses start reviewing records and then sending kids back to go get their vaccines. So it'll be busy. Other monies, that's kind of the big ones, FPHS and COVID. Those are our major grant applications right now. Other things that are kind of on my plate and with Ian as well, code enforcement, especially around solid waste code enforcement, it's got to be a big thing. So we have done some outreach to the homeowners associations, and in some ways, the problem is just really big with solid waste out in the community, and in some ways we're hampered. Ian and I are working through some of the things around the citations.
And abatements.
Yeah, what's that?
And abatements.
And abatements, so getting some answers on abatement, what we can do. We have a few lined up that want to get their properties cleaned up, but they don't have the ability. So we need to make sure that we're doing it correctly, but they're in line to do an abatement, get the property cleaned up, and then in some way we have to recover those funds, whether it's a lien on the property or a lien on taxes. And what we're trying to not do is to have it a lien in such a way that the interest continues to accrue at such a rate that we wind up with the property down the road. We don't want to have that happen. We don't want to be in the property owning business. So working with other county staff to figure that out.
Well, even if you did it in the form of a loan, you still have the lien on the property.
Yeah. So the way the code's written is, if a person wants to do an abatement and they do a payment plan with me, I can approve a payment plan. But as soon as they default on the payment plan, then it goes back over to the county and goes into the county system, and that becomes a lot more onerous. So if they can do a repayment, That's ideal.
What about the vouchers?
And we were using vouchers for that as well. So we did go out to Shorecrest with the team and looked at some properties out there, and Wendy's been working those with vouchers as well. Some things that people think are solid waste problems aren't solid waste problems, that they're just not neat. You know, and we're not the neat police. So there's a lot of education that goes with that as well. They're like, let's look, that property is a mess. Yes, it is, but it doesn't qualify as solid waste. You know, we agree that's not something you want to look at, but it's also not illegal. So there's been a lot of that process going on as well.
Shorecrest was also interesting in that the community itself had offered to clean up people's properties for them, just cost-free. They would have volunteers come on, they'd do the cleanup, haul it off, and they couldn't get cooperation from the property owner. So it's more complicated than just.
Well,
Right.
when you are in a situation where you have a big mess at your house, you have something else going on,
Yes.
and they don't see what we see,
Mhm.
and they do not see the need that we see. So there's always
Yeah.
something else
Right.
going on.
Right. So, been working those issues with Ian, and that has actually taken quite a little bit of time in the last month or so. It's working through the solid waste complaints, and a lot of education going on out there. So,
Now, we just hired a new one though, didn't we?
and that person starts soon. We've got 2 people starting
June
June 1st. So, and we are running out of room. So, the county administrator and I are going to have to sit down and really, as these programs come in, where am I going to put people?
There's
So-
an opportunity opening up that just won't be in that building.
No.
We have office opportunities.
So,
No.
we're watching, and you know, what I'm thinking of doing is if I need to make moves, it'll be divisions moving together. But we'll see.
There's the empty buildings up by the hospital now, too.
Yes, and
Can they-
Eric and I are talking
can
about
they
that as
lease
well.
them to us
Yeah,
at a very discounted rate.
we're talking. And in fact, that's kind of how we were working with the WIC, and I'll let Melissa talk about WIC, because that's kind of the method we use with WIC. So, that is what I have. Oh, no, that's not all I have. County health rankings. I gave you each a copy of the county health rankings, and we went down in health outcomes 2 slots this year, so we did drop from 23 to 25, but really our outcomes didn't change drastically, but 2 other counties did better than we did, so.
Yeah, but it was like 8 years ago, we were 38 or 39.
We were pretty low.
Yeah.
Yeah, so on the health factors, we're still in the bottom, very bottom.
Can't have everything.
But no, but it's a lot of those things around health behaviors like obesity we were talking about a little bit ago, inactivity, those things, and then access to exercise opportunities, we rank pretty low. But it's how they measure it.
Yeah.
It's how far do you live from a gymnasium?
Yeah.
You know, not do you ride a bicycle, not do you go fishing, and you know, it's how
Not
they.
that you're a mile from a walking trail.
Right.
Right. So it's how those things are measured makes the difference. So these are snapshots in time. What we track over time, you'll see in the community health assessment is probably more accurate. Well, it is more accurate. So, and actually, kind of along those lines, we have invested in a program called Insight Vision, where we are taking our strategic plan and then the work plans and dropping it into the program. And then as people are working in their programs, they have to track outcomes. Not just how much money is spent in the program, but how much things are actually moving the needle. Because we want to know if we're making progress, great. If we're not making progress, then we need to regroup and maybe change whatever that program is. But we've not had a tool that allows us to do that fairly easily. So Melissa and I are taking the training on that, and we probably won't go live on that till July, maybe later. There's quite a bit of training. And they're doing us a favor, they're taking our stuff and dropping it into the program and doing a lot of background work for us. So it was something that was used back in 2016, I want to say 2017 maybe, by 4 counties, and they dropped out. So we were able to pick up the license for a song, just to keep it going, and we're going to revamp it and use it to actually track progress within public health, and you know, demonstrate, especially to ourselves, the worth of what we're doing, making sure that things are actually changing in a positive way. That's it.
So, yeah, okay. Anything for Dave on that? Any questions? Okay. Move on to our environmental health report. Ian.
Oh, did you want to talk about Board of Health membership and attendance, or not this meeting?
I'll talk with the board chair.
Okay. In case you did want to know the definition of a syndemic, it stands for a synergistic epidemic, which is an aggregation of 2 or more concurrent or sequential epidemics or disease clusters in a population with biological interactions. So,
You just read it and I still don't know what it is.
Yeah.
synergistic epidemic, multiple epidemics working together to create a super epidemic.
Doesn't matter how many times you say it,
I tried.
that's all good.
My Board of Health report became inaccurate like 30 minutes after I sent it, as far as the staffing update goes. We have 2 people starting on June 1st, not 1. Randy Ocean was supposed to start on the 16th and had to push it back due to her relocation delays. But now Lexi McCargaw, who was formerly with the City of Shelton and as a code enforcement officer for them, is going to be starting with us on June 1st as well. So, yay. She's going to do solid waste code enforcement, which is very similar to what she was doing for the city. So,
Cool. Sorry, Kathy.
That's okay, you still are people too.
Yeah, that's what we do.
Her and the other one were very, very effective. I went with them, was trying to get you to come with us for some of those things they did through the walkthroughs in the apartments. They're tough, man, in a good way. Matter of fact, they knew what they were doing, and they knew how to deal with a lot of different issues at one time. I was very impressed.
Yeah.
yeah, so we're eagerly awaiting their start.
Maybe we can contract with the city.
Well, there's something coming up with that, actually. Not in code enforcement, for something else. There's another.
Hey, can we borrow them? We need them.
I was going to be able to say also that I'm fully staffed, but no, I am down one water quality specialist. So now I'm just
How about that one?
so I am at 9 staff positions right now. So I'm short 1 right now. Were there, as far as solid waste abatement, Dave kind of talked a little bit about it. We're just waiting for a final word from the prosecutor's office on whether we can put a lien on a property without eventually taking away their property, because the lien becomes property taxes, and property taxes that are not paid within 3 years become property of the county.
Yes, but we used to be able to do that, so I don't know why it switched over to where it became.
It's an ambiguity in the way
There
the
was
code is
there
written.
was solid waste over for many, many years. Solid waste liens would just stay on the property and they'd go with it when it was sold. And it was separate from property taxes. As a matter of fact, when property taxes, and you bought a home through property taxes, it went to pay off those liens as next in line, but.
And we just resolved one of those.
Mhm.
And the original lien was 6,000 and change.
Yeah, it
Okay.
ended up being 12 something.
18.
Oh, was it 18?
It was 18 something and change, with the interest over time.
Well, and that part was the same. They did charge interest in all those years, and when they sold their property, that got paid off first and stuff, but didn't require foreclosure on the property. That's a whole legal process you have to go through. It's not automatic.
Yeah, it's not automatic. It's
For
the-
taxes it is.
Yeah, but there's still some nuance. Tim deals with these every year. But there's this paragraph that's just slapped onto the end of the solid waste code. It says, how are costs recovered? it gets cleaned up with property taxes and then is taken in tax sale. We don't think that it means we have to go that route, but Tim wants to be sure and just make
Well,
sure
if it's
that,
code, then bring it back and then we revise the code. Sadly, I think I do remember that, which means I would have been a part of that. Apologies, because I think we were not going through and we were not following through, and so we're looking at options 10 years ago to do something with that. But if we put it in, we can take it out.
yeah, it's just a matter of, we were hoping we could get 2 projects done before this current, June 30th, when we have to give money back to the state. We were hoping to get at least 2 projects done, and it doesn't look like it's gonna happen in that time.
We put it in because of the sewer. Because of past due sewer bills and loans that we had on the sewer, that's where that came from, and it encompassed that. So it was us,
Okay,
which means it's us that can pick it up. Yeah.
yeah. Yeah, it's something that we could make a code change for, it's just not fast. So it will get resolved one way or the other. We will have a process. It just is not gonna happen as quickly as we were hoping. We can jump to this after. I should put the order different. Water quality, there are several downgrades, and I'm gonna show you some information, but we'll skip that for a second. We're gonna start our septic blitz in June, and that's just, a lot of you probably received those, just those mailer cards, and I put a copy in there. This year, we're combining that with the WSU septic maintenance courses for homeowners. So hopefully we'll get more attendance. We've had a lot of very low attendance to those courses lately, and we have 1 in person and 1 virtual. So we're happy to hopefully get a lot of participation in that. In previous years prior to the pandemic, we had tons of people going to those courses, and they were all in person at that point. We are going to be going to a new food inspection system that will, the most important part of that from a public standpoint is everyone will be able to go to any restaurant and look it up and see how they did in their food inspection. But it's always also going to result in a huge time savings for our staff because they're not double entering everything. Right now, they go to a restaurant, they inspect it, they fill out all the forms, and they get it signed by the facility manager. Then they come back to the office and they put all of that same information into our electronic database, and it's just double work. And this will eliminate that 2-step process. It'll be 1 step for them. Huge time savings. So we're really excited about that.
Pat on the back for you and your people, and that I have a food trailer. My son, I was not there. My son was there when they inspected it. She did a great job of educating him. I was worried because I was hoping that he would have to stand on his own. That was kind of the goal. She educated him well, and then she came back and did the second one because we had some issues and stuff. He came back with a whole bunch of stuff and was teaching me, Dad, we have to do this, and it's supposed to be like this, and this changed back and then. When you got an owner that comes back like that, somebody did a good job. There's just no way around it because he's never done this before. He's 20 years old, and he came back with a whole book full of stuff to not that we were in violation, but to make it better. That's impressive.
That shows was effective. She
Yeah.
gave him feedback, and
Yeah.
he wasn't just like, I don't know, she said a whole bunch of stuff.
Yeah.
I don't know what it was about. That's good to hear. As far as, let's see, yeah, so they sent us a letter about the downgrades. I'm going to share my screen now so you can all see this.
I believe it. I'll look at the reflection in
Yeah,
your glasses.
Trying to get rid of that. Yay. Okay, so whenever there's downgrades, the Washington State Department of Health, they have this initial phase where they write a report and they say, we're going to possibly reclassify these areas, but the reclassifications don't happen for 4 to 6 months sometimes. And last year we had this situation where they said, oh, we have these areas, they're bad, we're gonna reclassify them, and then they had several more months of sampling, and they then met standards, and all the, I guess, drama or anticipation of closures never happened. In this situation, they have 2 areas where we think there probably will be downgrades, just because the data that they're looking at that would fall off, even if we had pristine sample results for the coming month samples, that probably won't be good enough to prevent a closure. So they sent me a letter, which you can see up there, just saying that there are stations that were threatened with downgrades. Unfortunately, this year we were the only county with actual closure areas. Now, last year it was another county that was that county. This year it's us, so it's not like we're unusually special.
Were they upstream of us?
I can't remember. It might have been Jefferson for that one. So kind of that's what it is. Their pollution finally made it down to us and closed our stations. If anyone has questions about classifications and how they're made, I'm happy to answer those questions. I'm going to get to the meat of it. So there are these thresholds, that 43 fecal coliform per 100 mils. That's a threshold that is outlier kind of sample results. So when they collect a sample and it's really high, there can only be so many of those samples that'll close the station, regardless of what the overall average is. So they call that an estimated 90th. And those are really the events that cause closures. And unfortunately, DOH decided to sample during the heat dome and not discount that data when it's an extreme weather outlier event. And they're keeping that data, and that is pretty much the sole reason for most of our threatened station issues and closure issues. But that's their process. It's based on FDA's rules, and there's not much anybody can do about it. So the first one is the Annis Bay growing area. Not long ago, we had a additional downgrade. This kind of looks blue on my screen. That blue area is a restricted area, so they can grow shellfish in that area, but then they have to move them to a different area for what they call deparation, so the shellfish kind of clean themselves up before they can send them to market. So that area was kind of the worst area, but now we have this station way out of the tip where it turns at Union, and that station is failing. The way they determine what areas they're going to close is they go to the nearest passing station. So there's nothing out, if you kind of follow the flow of water, there's really nothing out past that station 195. So more than likely they're going to close everything out to the approved harvest area. Potentially out to 196 could get closed, but they'll finalize all of that. But typically the way they make those classifications is they close out to the nearest approved station. So it could be a really big area, or they might do some statistical manipulations and say, well, we're estimating that it's not going to be that bad, so we're going to close it less. But typically, in most cases, that's how they do that closure. In this blue area, they made that closure pretty much specifically on those lines. 206, 299, and 197 at that time were passing, so they closed out to that area. But this is one of those where they said, if our next few months of data are pretty clean, this probably won't get downgraded. But if we have a bad month, it could be a closure.
What is it, 5 in a row, or?
That's
what it used to be.
They're looking at 30 samples. So as you move forward in time, those older samples fall off of that 30 group, and you get the next few. They sample, depending on the area, every month to every 2 months. So it depends on how many we get in that time frame coming up. The next area is Lilywop. So this is one that we could see some public feelings on, where they'd be a little upset. So there's a recreational shellfish beach right here, and about half of that beach would get closed, so they would probably close out to station 185. This is one of those locations where they are not expecting, even if we have pristine results, for it to no longer be failing by the time they do reclassifications in like August, September. So there could be some public blowback on that one, just because it's a popular recreation site. And then the next one is the mouth of the Tuhuya River. This is a weird one. There's a stream called Caldervin Creek that kind of comes down this little valley here and flows out right here. We sample farther up the Tuvia River, and it's really good. We get really good sample results there on our ambient monitoring on the county side. But this station, which is right in front of Caldervin Creek's outflow, is failing now, and it's another one that they don't expect is going to
That's an area that floods,
Yes,
is what it is, so it goes into their septics and stuff like that.
that's kind of our suspicion. We've been doing some work out there, doing some extra monitoring right on Caldervin Creek to see if we can try to get ahead of it as much as we can.
Well, they're this close to dredging some of that out there, and the county is working on getting their permits to dredge as well. If that happens, that may change but probably not in time for what you need.
Yeah, I mean, dredging might, but, oh, you mean to actually dredge Caldervin Creek itself?
Yes.
Oh, okay.
And where the residents are, if it keeps it from going into their septics, it may be able to keep it clean. But when it floods and goes into the septics, it just washes out.
Yeah, they're constantly stacking sandbags up on either side to try to keep the creek in the creek. But, you know, again, probably closing out to 216 and 218 there. Not a huge area closure, but I think it would impact some of our growers. This one is just a site of concern, so it's a threatened station, Station 125. And we're currently working with Oakland Bay right now with a fairly intensive shoreline project, or we were before I lost a staff member. And so this is a site that we were already kind of working on, but it's not failing, it's kind of halfway to failing. So it's one of those where they say, it's getting up there, you might want to start working on this one to get ahead of it, and that's exactly what we're doing. But those are all the sites, and there's lots and lots of data in here if you decide you want to dig through the numbers. But did anyone have any questions about the closures or closure areas? What it means for the county as far as increased workload goes, are any areas that close that don't already have a closure response plan would need a closure response plan written. It's not a huge burden, but it's probably a 40 to 50 hour project for a staff member to write a closure response plan. So if we have two, that's 80 hours.
So once those are written, can they just be updated yearly?
They can be, and that's what happened with Annis Bay. When this went from a conditional area to a restricted area, I had to rewrite part of the closure response plan to include that new information. But we didn't have to create a whole new closure response plan, so that one was pretty fast.
Do you have a way of checking to see if that area historically has had issues? And there was always the question of the lagoon, but they've tested it and found that the lagoon flows to Oakland Bay. It doesn't go the other direction. They've attributed it to animals out there, but it keeps happening again. It makes me wonder if there are times where it's coming from.
Are you talking about
Eels Hill?
Eels Hill. Yeah.
So that flows out towards
Cranberry,
Cranberry.
yeah.
Yeah.
But they when they mapped it in the early days, they said it would come out toward. It actually went the other direction because it's a hillside, so it went down towards Oakland Bay and did not go to the
Right.
canal. But
Yeah.
I can't help but wonder because there isn't much there, and they attributed it to animals back then, and there isn't. But if it keeps happening, there might be something more to it than that. Maybe it's seasonal.
It's really a mystery. The data used to be closely tied, because you're talking about Annis Bay's issue. The data and the Skokomish River, the data used to be closely tied in Annis Bay to flooding of the Skokomish River. But in recent years, it's not really related to that.
Yeah.
The correlation has ended, and that's why a lot of these areas have turned into a closure when the river is over 15 feet, and a closure between the summer certain months in the summertime. So there's a double condition on that, and that just shows you that there's a lot of things going on there. We're in conversation with the Skokomish tribe, and one of our intentions is to eventually, we don't have to turn this into a water quality meeting, but one of our intentions is to explore microbial source tracking, which is trying to get sample results when DOH gets their high sample results, simultaneously sampling with them to say, okay, there's fecal coliform bacteria from what? And microbial source tracking could tell us if it's cow or dog or human or wildlife,
yeah.
seals, birds.
And that's what it did years ago and came up with it being animals. It just, at some point when it keeps happening, it just seems odd.
Well, was it animals or was it cattle? Do you know?
I believe it was deer,
Okay.
and that type of animal back then, but that was a long time ago. But it just makes sense as our weather systems are changing and maybe our drainage is changing as things dry up for a year. You know, if water finds a new way to get to where it used to go. Maybe it's changed, so when we do that, if we do that testing, we'll, you know, pay attention, because that might show something different. If it does, that's gonna change everything for our lives. As you know, because you were part of that before. The community and all heck will break loose, but we need to know.
Well, we've sampled extensively this whole shoreline for the past, going on 3 years now. We sample everything flowing off the shoreline, and there's been nothing that's high. It's just, there's no sources that we can find coming off this shoreline. The tribe says that it's the farmers up in the Skoke Valley. DOH says it must be septic systems along the shoreline. If it is, we can't find anything. There are failures along the shoreline that we know of, but they're not being used. They're not systems that are actively being used, so there's no flow going into them. We just can't find a source, which is why microbial source tracking hopefully will tell us something.
Ian, do you know how many commercial growers will be impacted by the closures?
I couldn't tell you for sure. I could look it up and we could possibly see, because on the DOH website, on their commercial shellfish map, there's a layer you can turn on for grower sites, and it shows little dots for where they all are, and we can look and see.
Okay. Yeah, I mean, you can even just say, if you can just send me the link, I'd be interested.
Okay.
Just curious about, you had mentioned the recreational, potential for recreational impact. I was just curious about commercial.
Yeah, the DOH said that there could be a couple growers that are impacted, I think by the Tahuya closure. But they said that they didn't expect it to be a significant impact. But, I mean, when they still haven't decided exactly what the closure area will be.
Hard to say.
A lot of it's, a lot of it's up in there. Any questions about the closures? I believe that covers all those items. Great, I can't see my bar, sorry. Trying to find my windows. Okay. The on-site, next item is the on-site sewage advisory committee bylaws. Taking the feedback from the last meeting, we made some edits to it, and all we were really doing is updating language, taking the feedback of the board from the last meeting, and trying to stick as much to what the committee themselves already said that they wanted to see in their bylaws. Any comments, feedback, things you like or don't like?
Look good to me.
Me too.
Anybody want to entertain a motion to approve those bylaws?
The changes. I make a motion, we approve the changes to the on-site sewage advisory committee bylaws.
I'll second.
It's been moved and seconded to approve the updates to the on-site sewer advisory committee bylaws as presented. Any discussion?
Great job.
Thank you.
That'll call,
Sorry.
with that, I'll call for the vote. All in favor, say aye.
Aye.
All opposed? Motion carries. All right.
And then segueing from that, we have a membership application for a, this is an existing member of the committee, Paula Johnson. She designs more systems than any other designer in our whole county. I think she accounts for something like 30 or 40% of the designs. So she's a very prolific designer. She's a current member of the on-site sewage advisory committee, and she's applied to continue her appointment for another 3-year term. I don't know if anybody has-
I make a motion, we approve Paula Johnson to continue her term.
I'll second.
It's moved and seconded to reappoint Paula Johnson to the on-site sewage board. Any discussion? Okay, hearing none, I'll call for the vote. All in favor, say aye.
Aye.
All opposed? Motion carries. Thanks, Paula.
Yeah, right.
Yeah, she gives us a lot of good feedback. She keeps us on our toes for everything. And that's all I've got for you.
Great. Anything for Ian? Commissioner Moody, anything back there? Okay. So we'll move on to Melissa and the community health report.
Okay, I've got my report attached. Most of our programs are really business as usual. Just to piggyback a little bit, Dave shared, an update on the syndemic approach to infectious disease. What is it? Syndemic approach to infectious disease prevention and linkage to services. We've been working really hard on that grant. We're really excited to expand our services. I think that the population and the participants that seek services at Mobile Outreach and our syringe exchange program is a population that is historically either unwilling or unable to seek care elsewhere, but have other diseases, transmissible diseases, things like that. So I think by doing the STI testing and the HIV testing and Hep C testing and the potential for treatment is really going to help meet people where they are. So we'll be applying for that, and the application is due in about 2 weeks, so we are very hopeful. WIC, brief update on that. We've had to do new classifications for the positions that we're hiring. So we're going to hire a WIC coordinator supervisor for the program as well as a WIC certifier. A lot of people have reached out to us, people who work for other WIC programs or who are interested in working for WIC. So I think we won't have a shortage of applicants. Hoping to brief those positions. HR is currently reviewing it now. So I'm hoping to brief those positions so that we can post them in the next, I think the first briefing of June is the goal. So you'll see that. Another really big kind of achievement that we've had, I work very closely with Mason County Sheriff's Office as well as our partners at Olympic Health and Recovery Services. I think the contract was just approved today for a law enforcement co-responder program. That is going to be really huge for our community. I think the reality is there is just a really high mental health need, and there are services that just aren't really meeting that need. So this is something, if you're not familiar with the model, the co-responder team, there will be 2 teams. So each team has a clinician. I don't know what the qualifications are for that, but there's a clinician and then there's a peer, and they actually go out and they're able to respond to calls that don't necessarily rise to the level of need for someone to be incarcerated, but will get them connected to services and treatment and things like that that they need to get their needs met. So those are the biggest things. Really have a big emphasis right now returning to working on our work plan, evaluation, and kind of looking at what programs, what they've accomplished. And like Dave said earlier, we're using Insight Vision to actually track outcomes. It's really important. If we are doing something really well, how can we continue to do that? And if we're not doing something very well, then we're going to look at how we can improve them. That's kind of where we are, which is business as usual, but improving, and lots of grants. Any questions about that?
That's cool.
Great, thank you. Other business or board discussion, anything from board members?
I do have a person in the audience here that I'd like to introduce.
Great.
So Julie is our executive director for Blue Zones, and her office is over at the EDC right across the street from Public Health. So Julie is working with us in our community forums and is now an ex officio member of the Mason Matters board, and will be working with us for like the next 3 years on first things is food systems, and then next is
built environment.
Built environment. So starting that work with Blue Zones, like I said, it's a 3-year contract, and off we go. We're actually about 6 months into the first project.
Yeah. It's the first project of its kind in the nation, so that's what we mean by off we go.
That's cool.
Great, welcome. Do you want to maybe introduce yourself a little bit further?
Well, I think I brought the pollution down from Jefferson County. I think it was Dabob Bay the whole time. I'm thinking, oh boy, does it travel that way? Oh no. Yes, so I live in Jefferson County. This project is sponsored for 3 years, And there's another one in Grace Harbor and then another one in Lewis County, and we're all sort of working together, but it's on health and well-being. Now, what that means is most recently there was kind of like an audit of food systems in Mason County, talking to farmers, the Salmon Center, the hospital, restaurants, grocery stores, to do an examination of what might be needed in the food policy world for health and well-being in Mason County. And so we'll have in about 6 to 8 weeks a public meeting to talk about those findings. That's not necessarily the way I would have gone about it. I probably would have been, said hello to everyone before we went into it, but they did a pre-survey before they started. So we're sort of catching up here to what was found in the past that Blue Zones will be presenting, but there'll be an open house in 6 to 8 weeks. I'll be at the Forest Festival. Come see the booth and get a bike light. That's all I have so far. And I think there's a lot of room for public involvement and moving this the way that Mason County wants it to go. So thanks for having me here today. Any questions?
Welcome.
Are you going to be at the Bite in July?
Yes, I'm going to be at the Bite in July. Mhm.
Okay.
Excellent. Well, welcome. Thanks for joining us today. Any other board discussion before we move on to public comment? Okay. Any public comment? No, looking good. Okay. With that, I'll entertain a motion to adjourn.
I second.
Moving second, we adjourn. All those in favor say aye.
Aye.
All those opposed? We are adjourned.
Okay,
Have a good
I need
afternoon.
your help to send me a letter.